a clinical meeting this evening. I'll be talking on the topic, family dynamics and COVID-19 pandemic. So, and I have to be discussing this topic under the following outline. So I'll start by introducing the topic, then definition / overview of the concept of family, the concept of family dynamics, and we'll look at some of the factors that influences family dynamics. And we'll also look at COVID-19 pandemic management and how COVID-19 pandemic has affected family dynamics. We'll also look at the role of a family physician. Then we'll conclude
Are you using your phone as internet connection?
Yes, I connected my phone to the laptop.
Okay, so maybe you might need to put your phone on do not disturb so that calls will not enter.
Okay, so we'll quickly look at different types of family, which we have to do with. And first, the form of dynamics that exists with each type of family. So we have several types of family, which include nuclear family, extended family, we have single parent family, we have childless family, we have blended family, we have adoptive family, we have foster family, skip generation or grandparent family, polygamous family, gay lesbian family, then communal family. So we'll look at normal function of a family. Basically, there are 5. The concept of family, for it to be functional, or for it to be called a family, it has a 5 basic functions, which include they provide support to each other. They establish autonomy and independence for each person in the system. They create rules that governs the conduct of the family and its members. They adapt to change in environment, and they so family dynamics as a concept, we define it as the pattern of interaction between family members that influences the family structure, the hierarchy, roles, values, and behaviors. So, and we said this dynamics in family can either be a healthy one, that's the pattern of interaction, can either be a healthy one or a destructive one, and a destructive interaction. And it could also be a blend of both. So, which we can actually assess using a family tool, a family ABGA, to determine if a family is functional or dysfunctional. So, and we said that a functional family is where there is a balance between these basic functions of the family. So imbalance may result from either over or under emphasis of these functions. So, and a dysfunctional family, we said, is a family with a chronic inability to respond to the needs or to cope with the changes and stress in the society. So we look at some factors that can influence family dynamics. They include the nature of the parents' relationship, the parenting style, that is having a particular, either a soft or a strict parent, then the number of children in the family, the personality of family members, an absence of a parent, the level and type of influence from extended families or others, the health status of members, then events within the family, such as affair or a divorce, trauma, death, unemployment, or homelessness. Other issues such as family violence, abuse, alcohol, or drug use, or other drug use, mental health difficulties, and disabilities. Then factors like family values, culture, and ethnicity, including beliefs about gender roles, parenting practices, or status of family members, affects the dynamics of family. Then the nature of attachment that exists in the family. And we also have dynamics of the previous generations, how generations has, how it has been with generations in this family. Other systems which include social, economic, political systems influencing family dynamics. So we look at the overview of COVID-19 pandemics. What about COVID-19 pandemic that necessarily affects family dynamics? We look at some of the measures in curtailing the spread of this virus. And it was noted that it was some of these measures, these management measures that was put in place to curtail the spread of this very infectious disease that has this impact on family dynamics. So some of the measures include social distancing, the lockdown period, which could be partial or total, wearing of face masks or face shields, then hand hygiene by washing or use of alcohol-based sanitizer. Then in the case of a positive subject, contact tracing involves self-isolation of this patient for 14 days or more. Then contact exposed to stigmatization. Then this contact tracing puts a strain on the persons and the facilities in the isolation period. Then in the care of these patients that is outside the treatment center or the institutionalized care for this patient or a stable patient, we expect the patient to remain in isolation until result is negative or cleared by a health officer. Then you expect this patient to stay in a well-ventilated room. Then there should be a limited movement in that house and limited shared space. Then also limit the number of caregivers for this patient. Then you should make sure that this patient have separate bedrooms or bedroom disinfected after each use. Then they should be ready to call for a bed in case the condition of this patient changes. So the impact of these measures that we outlined above on family dynamics is what we are going to look into now. So with restriction of social gatherings affects workplace. It affected the leisure, cultural, and religious gathering. The family structures, roles, needs, and relationships were put under unfair strain. Households were forced to share limited space and do this for a longer period of time. And families experience loss of community and freedom of movement as in response to the restricted measures. They also complain of loss of planned activities and celebrations. There was also increased job or income loss due to these measures. A lot of business suffered a loss. So this probably led to increased job loss and income loss among families. So it was noted that this impact was associated with some form of parents' depressive symptoms, stress, hopelessness, yelling, and some other negative interactions with children. Then substance abuse, alcoholism, there was personality clashes, aggression, anger, and all this increased the risk of domestic violence or intimate partner violence. So it was also noted due to those measures that parents that had an exposure or infected with the virus was associated with less interaction between them and the children or other members of the family. And this also it was also noted more child behavioral problems because of lack of the guidance or the parents or other members of the family around. So for school children, the school closures actually interrupted the learning process in children. Then following the restriction measures, it was also noted that there's an increased expenditure due to increased population at home. Then during that period of this measure or with the measures on ground, which includes restriction of movements, it was noted there was inflation affecting cost of products and services, which probably due to the either that the restricted movement prevents as regards to production of goods. Farmers were actually restricted from going to their farm. So there seems to be less supply of goods and including services during this period, which actually led to inflation. So with increased number of people living in a limited space, some challenges like protecting the elderly, which are particularly the ones that are at risk of getting this or contacting this virus, especially the ones that has chronic health conditions. Then they are also faced with challenges when an infected family member is in the household, because this patient that is infected or exposed have to be given some space, then making the little available space smaller for the remaining part of the household. So in situations where one or more of the family members are health workers or essential workers, they also poses a high risk of infections to other members of the family in this same limited space. Okay, so with increased number of people in this space, there also tends to be a challenge with sanitation. So with social distancing, which is a measure, part of the measure, and other isolation measures, COVID-19 propel loneliness with its potential detrimental effects, which include depression, vulnerability to abuse, aggression, violence, addiction among violence and addiction. And this is basically among individuals who do not have regular contact with other family members, as we can see in most elderly people who most times their primary source of social contact is the family members. So with this social distancing and isolation measures propelled by COVID-19 pandemic, they tend to suffer this loneliness and its detrimental effects. Then also following stigmatization of these patients and the family, there could be an abandonment by this patient's own family. Then there could also be hostility from neighbors. So other effects include the healthcare services at that time were inaccessible, some were unavailable, or they are feared due to the pandemic. So, and this resulted to some effects like home care of a sick member of the family who otherwise could have been on admission. And taking care of this sick member has its own impact on the dynamics of the family, which could include taking the time of other family members, financial pressure, and then stress for other family members. So at this period, there was also loss of family members, whether from coronavirus or other causes. And when this occurs, the effect on the dynamics of the family will involve the change of role. For instance, in a place where the husband dies or is ill, the responsibility changes. The wife assumes the role of both as a wife now and as a husband. So also there's emotional pain from that loss. Then there was also noted increased level of fear and anxiety over uncertainties during this pandemic. There were a lot of fears as regards to contacting the virus, the fear of death. That's in the case of illness in any member of the family. Then also uncertainties about what the future holds as regards to this new style measures introduced by this pandemic. So at that period of pandemic, it was also noted there was some level of interrupted services, that's healthcare services, and which we see in some patients, especially family members living with non-communicable disease. They were unable to cope with the follow-up for their medications, and some of them, due to the longer period of stay at home, they deviated from some of the lifestyle modifications which was part of the treatment for the background non-communicable disease in the family member. Then treatment plans for diseases like tuberculosis, leprosy, HIV was also interrupted. These are people that are supposed to be coming for their routine drugs, but due to the restrictions or due to the fear of uncertainty or fear of contacting this virus, they defaulted with follow-up and management. Then under 5 clinics and services, which include immunization. Some of those under 5 that are due for immunization against vaccine preventable diseases at the period of this pandemic, were unable to approach the facility for the services. Then some services like family planning, some women that were on monthly family planning um, plan were unable to continue with that services because of the restriction or the presence of the virus, the fear of the contacting the virus. So these are mostly the negative impact. So we look at some of the positive impact of this pandemic in family dynamics. So at that period of pandemic, it was noted that many couples redefined their relationship, that they had quality time with families. Then they build genuine relationship. They find it as a rare opportunity to enjoy the new found time with each other. They pay attention to things that matter at this period, then talk to each other and really listen because they felt they have time. So then family gets to know their members again. Then the school closure had an impact positively, which include especially in the mothers, which they said increase the time the parents, especially the mothers, spend with their children. Then this time was also noted to have reported a positive parent-child interaction. Then in some parents that had parental job loss, but without income loss, as was seen in the case of most civil servants, irrespective that the fact that they are not going to work, they still receive their salary. So their income was still intact. So it was noted to have a more positive parent or family members interaction. Then the generosity of the federal government's response in supporting the public with stimulus funds and foods, which was actually targeted to low income households, was actually delivered to families. Some of these families received some relief materials that even even without the presence of this pandemic wouldn't have been able to. But because of the pandemic and the generosity of the federal government, they were opportune to gain those stimulus. So at that period, it was also noted that the environment, less people were in the environment, so the environment tends to be cleaner. There are less people out there to litter the places, so everywhere was noticed to be cleaner. Then opportunity, it will serve as an opportunity for reassessing our priorities. Then some families saw that period as a chance to initiate healthy lifestyle, which includes dieting, exercise, then relaxation. And it was also noted as an opportunity to learn new ways of achieving set goals, which include this our form of clinical meeting. Then the visual studies for schools, also update courses went visual. And these were things that were not obtainable before pandemic. So we also have the novel way of communication that can be maintained after the pandemic. So we look at the role we play as a family physician in this impact that this pandemic had on family dynamics. So as a first point contact and as a clinician, we should be, as a family physician, should be skilled enough in able to diagnose, identify and diagnose COVID-19. And not just diagnosing COVID-19, we'll be able to treat COVID-19. Then the plan for this patient should be a holistic manner as a family physician, which will include being a good communicator. We should be able to carry the patient, both the patient and the caregiver and the other family members along as regards to management of these patients. We're able to tell them what the severity of the condition, the status, the health status of their patient, and then the prognosis of the condition of their patient. Then we should be able to coordinate care of a COVID-19 patient. That if, like in case of a patient that requires multidisciplinary approach, we should be able to coordinate this care and make sure that this patient has this care, receive this care. Then as an educator, we should be able to clear some myths. If there are myths as regards to COVID-19 infection, we should be able to educate the family members, other members of the family, as regards to the COVID-19 infection. Then also to the public, to the community, as regards to especially stigmatization of this patient. So we should be able to explain or educate the public everything they should know about this infection. Then contact tracing as regards to in a family that had a subject that was positive. A family physician should be able to do contact tracing as part of management or measures to curtail the spread of this virus. Then as an advocate, we should advocate between the patient and his family. We should be able to enlighten the family as regards to the patient you've managed. After managing this patient, you should be able to reintegrate this patient back to the family. Then try to make the family understand that this patient is fit and can still live a normal life post COVID-19 infection. This also has to do with the community you are taking this patient back to, or the family this community is in. So in conclusion, as the world opens up, we, the frontline doctors, need to remain at alert to this infection, to this pandemic, and the manifestations of the results of its impact on family dynamics. Thank you.
Thank you, sir. Chudi.
Thank you, Dr. Dr. Chudi, for the presentation.
Very beautiful presentation.
It was quite enlightening. Okay, so at this point, we'll be taking comments, verifications, questions from the medical officers and junior residents.
Sorry, thank you, Doctor. Oh, excellent. I was going to ask for the references. No, please put it back. Thank you.